Everyone, my name is Mike Ramey. I am a first year graduate student in the MSW program at Westfield State University, and I'd like to present research to you today that I conducted with a few of my peers regarding the effectiveness of DBT, reducing symptoms of suicidal ideation and self-harm in young adult males with borderline personality disorder. This research study aimed to answer the question as to whether dialectical behavioral therapy, otherwise known as DBT, is an effective course of treatment that can be utilized to aid in the reduction of symptoms of borderline personality disorder, otherwise known as BPD, with young adult males. Common symptoms of BPD are depression, feelings of hopelessness, impulsivity, behavioral and anger control problems, suicidal ideations, self-harm, and a lack of ability to maintain healthy relationships. This is according to Andreasen et al. 2016. This research sought to target the specific symptoms of suicidal ideation and self-harm. Acquiring a participant sample of 4 young adult males diagnosed with BPD and living in the same group home environment, this study used a single subject ABA design to test baseline intervention, which would be DBT implementation, and then new baseline in order to gain an understanding as to the effectiveness of the treatment in reducing symptoms. The DBT implementation did not include all 4 modules within the treatment model, but rather limited the modules of distress tolerance and emotional regulation. Results of this study showed a reduction in targeted symptoms amongst all 4 participants, with the highest rate of decrease being in the areas of suicidal ideation over self-harm. So borderline personality disorder, BPD, is a mental health mood disorder, has a specific variety of symptoms, some of which I previously listed, and the treatment for this illness varies from therapeutic intervention to prescribed mood stabilizing medications. There's no specific medication that will address all of the symptoms of this illness. Prescribers will typically take a trial and error approach to medicinal treatment interventions, which typically differs from one person to the next, and that's according to Choi Kane et al. 2017. So dialectical behavioral therapy, it is an evidence-based therapeutic group practice. It was developed about 30 years ago by a psychologist by the name of Marsha Linehan. She suffered from mental illness herself. It's kind of what was the catalyst to her seeking ways to cope, and eventually led her to the creation of this very valuable treatment specifically designed for individuals that suffer from borderline personality disorder. So Marsha Linehan tested DBT on BPD patients. She had positive outcomes, and she was able to make it a viable treatment model. DBT consists of 4 models within its curriculum. Those are mindfulness, distress tolerance, interpersonal effectiveness, and emotional regulation. And within those models, there's a variety of coping skills taught to address, whatever the area of the module being presented is. So the ones that we utilized for this specific research were strictly distress tolerance and emotional regulation, because those are the ones most relevant to the symptomatic behaviors that we were trying to target, which is the suicidality and self-harm behaviors. According to Fisher 2015, young adult men have been seemingly overlooked, being that BPD has been widely known as a disorder that predominantly affects women. He also claimed that research tells a different story and that BPD seems to affect men and women at about the same rate. He believes that our societal perception of gender roles may have something to do with the rate at which men tend to seek treatment as compared to women. Society seems to have constructed an idea that men should be quote-unquote manly and understand how to deal with their own problems, where women are more emotionally in tune and tend to seek treatment when needed. Also, society's created a perception that anger and aggression, which are common symptoms of BPD, are quote-unquote normal behaviors for men. So that's another reason why these symptoms get overlooked in men. Our literary review guided our sample selection and desire to focus on young adult males with BPD for this study. Psychosocial mental health problem requiring intervention. That was borderline personality disorder, specifically targeting the symptoms of suicidal ideation and self-harm. To obtain our participant sample, we reviewed several potential participants at group homes within a 20-mile radius in the city of Worcester, Massachusetts. The criteria for selection were that each participant was male between the ages of 18 and 26 years of age. They had to be diagnosed with borderline personality disorder and displaying specifically the symptoms of self-harm and suicidal ideations, among other symptoms, but those are the ones we were targeting. So the tool used for the selection was the McLean screening instrument. So the McLean screening instrument is a questionnaire form. It consists of 10 yes or no questions based on the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Each yes answer is rated as a 1 and each no answer at a 0. The volunteers who scored 7 or above on this questionnaire were identified as those most likely to meet the borderline personality disorder criteria. 10 volunteers scored 7 or above on this screening. So we were able to narrow down from 10 volunteers that fit the criteria down to 4 participants. And those 4 participants just so happened to live within the same group home environment. They all showed a history of suicidality and self-harm, and they were of mixed demographics. All of the 4 participants had similarities in symptomatic behavior, but they also had differences in their psychosocial histories, demographics, and medical histories. They were all involved in a generic coping skills group that was created by the staff that worked within their group home. There was no specific criteria to the curriculum to the group. It was just something that they did as routine every week. So that was run by the program staff, and all 4 individuals weren't involved in any other evidence-based practice type therapeutic groups. One individual did have a history of legal problems. So our hypothesis or intervention question, this study sought to answer the question as to whether or not dialectical behavioral therapy, DBT, minimizes borderline personality disorder symptoms, and specifically we were targeting the symptoms of suicidal ideation and self-harm, as I said, in young adult men between the ages of 18 and 26. So the design for our research study was a single subject ABA design. It's a 3-phase design, starting with a baseline, then we introduce the intervention, and then a new baseline where we take the intervention out. The baseline, the initial baseline, was a 5-week duration with no intervention, meaning no DBT group being initiated with the participants. They were engaged in their regular skills group. And then at week 6, we introduced the intervention where we did 2 modules of DBT. We focused on, as I said previously, emotion regulation and distress tolerance modules. By the end of the next 6 weeks, we took the intervention out, and for the next 5 weeks, we tested their symptoms at the new baseline via self-report measures. So we feel that this design strengthened our hypothesis, where it allowed us to measure before, during, and after intervention implementation. Our treatment intervention utilized, as I said previously, dialectical behavioral therapy, was developed by the psychologist Marcia Linehan in the 1970s. Research has shown that this is a viable treatment in the reduction of symptoms commonly seen with borderline personality disorder diagnosis. It works to address and reduce suicidal, therapy interfering, and quality of life interfering behaviors while improving behavioral skills. It consists of 4 modules that I spoke of previously. Each of them teach a variety of skills pertaining to mindfulness, interpersonal effectiveness, emotion regulation, and distress tolerance. For this research, we stuck with emotional regulation and distress tolerance modules. They were the only ones we utilized, and it was because they are the ones that we felt likely would be most relevant to combat the symptoms that we were targeting. Our methods. So we acquired a participant sample of 4 young adult males, all living within the same group home facility. We utilized the self-report measure called the Borderline Personality Disorder Checklist. It's a questionnaire consisting of 47 questions that gauge symptoms of BPD, and they were all on a 5-part Likert scale. The highest possible score for this questionnaire was a score of 235, where the lowest possible score was a score of 47. We utilized the ABA single subject design as our research design, and each week for 16 weeks we had them participate in the self-report measure. The first 5 weeks were at baseline, where there was no intervention implemented. The next following 6 weeks after, we did implement the intervention, as well as had them continue to self-report their symptoms via the questionnaire. And then finally, we went an additional 5 weeks at new baseline to test for validity. And here you can see the results of our research. If we move over here to the left, we see person 1, 2, 3, 4. Those are our participants. These represent the weeks 1 all the way to week 16. This area here in orange represents the first 5 weeks at baseline A, initial baseline. Then we move into intervention phase for the next 6 weeks, and new baseline A for the following 5 weeks after that. If you notice in the beginning, each of the 4 participants had extremely high scores, and that's represented here in the graph. You can see that they scored consistently high all the way up until the point of intervention. Once we reach the point of intervention, we see a drastic decline in symptoms, and that continues up until we hit new baseline A, when the intervention was taken away. And even here, we still see a decline, but it's a much less drastic decline. It's more gradual for the next 5 weeks. So results, what does that mean, what we just looked at? So at A, the initial baseline, the participants were scoring consistently high on their self-report questionnaires. The reference lines on the graph were all plotted moving in a straight direction for A, the initial baseline, and the duration of time of 5 weeks. At B, intervention, we saw the drastic decline in self-report symptoms throughout the next 6 weeks. We see this in the graph as the reference lines drop dramatically. And then at A, new baseline, we had taken away the DBT intervention over the next 5 weeks, and then we saw the reference lines in a continuous decline, but at a much less drastic rate. So during the first 5 weeks, the initial baseline, the 4 participants were engaged in generic coping skills group. It wasn't an evidence-based group. It was created and run by the staff at their group home, but they still reported high symptom levels during that duration of time. During the intervention period, which was the following 6 weeks, we saw a dramatic drop in self-reported symptoms. So we determined that this was likely the result of introducing the dialectical behavioral therapy treatment. However, there may have been factors unaccounted for, such as things going on in the personal lives of the individuals, but we felt that that was unlikely, being that we saw a dramatic drop in symptoms with all 4 participants. We then removed the intervention and continued to administer self-report measures for an additional 5-week duration, and we did this to test for validity. The result of that was a decline, but a less dramatic one, in symptoms, and it was our prediction that this was possibly due to their continued use of coping skills learned during the time of intervention. We felt that this study can contribute to continued research in that there are limited studies primarily focused on young adult males with borderline personality disorder, and we also feel that it could contribute and strengthen continued research regarding the effectiveness of dialectical behavioral therapy. So although we see the strengths in this study, we also took note of the limitations. First, we used a single subject design. The participant sample was very small, and it was not an adequate reflection of the greater population. With the single subject design, it's very difficult to get a diverse sample demographically. This study only utilized 2 modules of dialectical behavioral therapy curriculum. The research didn't account for factors such as to what degree the individuals were utilizing skills that were taught during the new baseline period after the intervention was taken away, and also the fact that they were all living in the same group home and knew each other prior to the study, as well as any factors that might have been happening in their personal lives, that might contribute to like mood stability or mood instability. And lastly, we used only self-report measures to gauge symptoms. We didn't obtain any data from observed symptomatic behavior. And that concludes this presentation. I want to thank everybody for taking the time to listen to this, and I wish everyone well. Thank you so much. Have a wonderful day.